nephrotic versus the nephritic syndrome. So here are the clinical features. Firstly, we are going to look only at the nephrotic syndrome. So nephrotic syndrome. So here, clinical features includes there is presence of edema, there is presence of fatigue, there is presence of the proteinuria. This is, we are talking about nephrotic. So I'm drawing an O. So there is proteinuria. There is absence of hematuria. There is no hematuria. And there is hypo. Because of proteinuria, there is hypoalbuminemia. Next, we are looking at the etiologies. To be specific, we are looking at the pediatric etiologies. This includes the minimal change disease. Now looking at the adult etiologies. This includes the FSGS, focal segmental glomerulosclerosis, as well as the membranous nephropathy and the membranoproliferative glomerulo, and this is the nephritis. Now we are going to look at comparing the nephritic syndrome. So here in the nephritic syndrome, clinical features include there is presence of the hypertension, there is also the oliguria. Here there is characteristic hematuria which is not present in the nephrotic syndrome. There is also proteinuria as seen in the nephrotic syndrome, as well as presence of casts. Now the pediatric etiology. This includes the post streptococcal glomerulonephritis, as well as there is presence of the hemolytic uremic syndrome. Now we are going to compare it with the adult etiologies. So here in adult etiologies, there's IgA nephropathy. There's presence of the membranoproliferative glomerulonephritis, and there is also the crescentic glomerulonephritis.